ഞാൻ ആദ്യമായി കോളേജിൽ പോകുമ്പോൾ ഭാവിയെക്കുറിച്ചുള്ള ആശങ്ക പലതായിരുന്നു. എന്നാൽ സുന്ദരമായ ആ ക്യാമ്പസിലേക്ക് കയറി ചെല്ലുമ്പോൾ ഒരു ആത്മവിശ്വാസം എനിക്ക് ലഭിച്ചു. നല്ല സുഹൃത്തുക്കൾ, സംശയം അകറ്റി വെളിച്ചം പകർന്നു തന്ന അധ്യാപകർ, പുതിയ ആശയങ്ങൾ നൽകിയ ലൈബ്രറി. ഞാൻ ആദ്യമായി കോളേജിൽ പോകുമ്പോൾ നല്ല ഓർമ്മകളുള്ള ആശങ്ക പലതായിരുന്നു. എന്നാൽ ഡിജിറ്റൽ ലോകത്തേക്ക് പറക്കാൻ ആ ക്യാമ്പസിലേക്ക് കയറി ചെല്ലുമ്പോൾ അങ്ങനെ ഒരു ആത്മവിശ്വാസം എനിക്ക് ലഭിച്ചു. നല്ല സുഹൃത്തുക്കൾ, സംശയം അകറ്റാൻ വളരെ ഹാപ്പിയായിരുന്നു എന്ന അധ്യാപകരെ പിന്നിലാക്കി പുതിയ ആശയങ്ങൾ നൽകിയ
MES Collage, Irumeli, proposed PR, Irumeli, Kottayam, unaided Arts and Science College under the Muslim Educational Society, approved by Government of Kerala and affiliated with the Mahatma Gandhi University.
Good afternoon, everybody. A warm welcome to all. Today, NSS units of MES Collage, Irumeli, in association with IQAC, conducts a webinar on role of National Service Scheme in COVID-19. The NSS units of MES College started its function in 1995. We have bagged Moses Award 2 times for NSS Best NSS unit, and we achieved Best Program Officer Award, Best Principal Award, etc. MES College, affiliated to MG University, started in 1995, and the very first year itself, it had started the NSS units of MES College had started its function in our college. It is situated in a remote place called Mukkutudara, and our NSS units had worked all-round development for the entire area. During the flood time, we have in the last 2 years, we cannot forget the achieved works and relief works done by NSS unit. At the time, the the state level itself we had got many appreciations. Today, we have here with our resource person and chief guest, Dr. Prasanth S., Assistant Professor, Department of Agriculture and at Government Ayurveda College of Preventive. My name is Principal of MES College, Irumeli. Dema Devi, a Vice Principal and IQAC Coordinator. Jidesh K.S., CDC Director. Sabjan Yusuf, IT Cell Director. Tansim, Jinish, Jace, and Anandu, Technical Coordinators. And most important, the NSS Program Officers, Mrs. Regula Oyam and Mr. Sergeant Anthony, and and the participants from all over India. Let's start the program by a warm welcome from our NSS Program Officer, Mrs. Regula Oyam. Over to you, madam. Excuse me, madam. You have not unmute your audio. Regula, madam, please unmute your audio.
Okay, ma'am. Good afternoon. I, Regula Oyam, NSS Program Officer. Today, NSS Unit 69 and 69A of MES College, Irumeli, conducting the national webinar on role of National Service Scheme in COVID-19. The major aim of National Service Scheme is the development of the personality of students through community service. It provides an extension dimension to the community service. We have 2 units, 69 and 69A. We got the awards from state and university and also achieved the best unit, best principal, best program officer, and best volunteer awards from university. My duty is to welcome all panelists and participants. Gladly take this privilege of extending a warm welcome to one and all present in this section. In this webinar, our main star attraction is Dr. Prasanth S.R. from Department of Agadadandra, Government Ayurveda College, Trivandrum. Dear sir, we firmly believe that you are the right person to preside our today's session. We appreciate your availability, hard work, and commitment. A warm welcome to you, sir. Among we have such an inspiring personality, Mr. Mahin Emman, Principal, MES Collage, Erimeli. Sir, you are indeed an inspiration to all those who come to you. We are very fortunate to have you with us. A warm welcome, sir.
Thank you.
We have Mr. Mrs. Ramadevi, the Vice Principal, IQAC, who is highly passionate about inspiring the needy and alleviate ignorance by conducting awareness drives. Ma'am, warm welcome to you. Now, I extend a warm welcome to all vice principals and CDC director joined with us who are living course of hard work and dedication. Welcome to you, Vice Principal and Jidesh sir. Also, I extend a warm welcome to IT cell director and members of their kind support. We welcome all the participants who are the key factors of the success of this webinar. Welcome all the participants in this section. Finally, I welcome all faculties, NSS volunteers, students, and other dignitaries from various institutions. Once again, welcome all to this webinar.
Thank you, madam. May I request Mrs. Ramadevi A, Vice Principal and IQAC Coordinator, to inaugurate the function. Over to you, madam.
Thank you, Shiva. Good evening, all. This is Ramadevi A, Vice Principal and IQAC Coordinator of MES Collage, Erimeli. As the IQAC Coordinator, I am happy to say that our teamwork helps to introduce many programs in our college, which help to improve the quality of education. IQAC, in association with various departments and forums of our college, has been conducting a series of national and international webinars. NSS is one of the major forum of our institution, which brings many awards to our college like Moses Trophy, awards of Best Unit, Best Principal, Best Volunteer, etc. Today's webinar is the sixth one of the second series. Our resource person, Dr. Prasanth SR, Assistant Professor, Government Ayurveda College, Trivandrum, is here to deliver his valuable knowledge on the topic of today's webinar. In this context, I feel proud to inaugurate national webinar on role of national service in COVID-19 organized by IQAC and NSS of our college. Hope all of you will get benefited of this webinar. Have a fruitful session. Thank you all.
Thank you, madam. May I request Mr. Sajid Antony, Program Officer of NSS Unit Erimeli, to introduce the chief guest, Dr. Prasanth sir, to all of us present here. Over to you, Sajan.
Good afternoon to all. I am very proud to introduce a enthusiastic and active and genuine and innocent man I met during the 88 training of NSS at Rajagiri in Kalamasheri. Here, Dr. Prasanth sir, currently working Assistant Professor in Skin and Toxicology Department in Government Ayurveda College, Trivandrum. And he is a member of Disaster and Quick Response Ayurveda team in Ayurveda colleges and lead member in Ayurveda team of COVID-19 surveillance at domestic airport, May and June 2020. Member of COVID-19 First Line Treatment Center at Pujapura, Panchakarma Hospital, as well as a lead member of immediate flood relief team at Chenganur 2018. He is a member of dengue and chikungunya outbreak management team. And he has 10 years of teaching experience in various government Ayurveda hospitals. And he is a regular presenter in national and international seminars and webinars. And he is a member of Commonwealth Games Delhi 2010 in Ayurveda team. And he done his graduation and post-graduation in Government Ayurveda College Trivandrum with high academic credentials. And I don't know how to explain him. He's such a nice character and such a nice personality. And we have a good friendship with each other. And during this webinar time, I just asked him to participate or just come to take webinar on this NSS. And suddenly he responded, and with happiness only he responded. And I also welcome in the name of our units and our college. Welcome, sir.
Thank you, Sajan sir.
Thank you, Sergeant, for the valuable information. Before start the presentation, I request all the participants please cooperate with us. You can ask your doubts through chat box and comment box, and wish you all a worthwhile seminar. On behalf of NSS units and IQAC of MES College Erimeli, I request Dr. Prasanth sir for the presentation. Over to you, sir.
Thank you, madam. Thank you, team NSS. Actually, I'm very happy to join in this seminar of COVID-19 or role of NSS in COVID-19. In this presentation, I am just giving you a brief of the disease COVID-19. Then only you can know how we can act in the national service scheme or how we can operate national service scheme in this pandemic time. Actually, it is very important that we have to understand the disease. Then only we can act in the right time and right manner. So I'm going to my presentation and starting the sharing of the screen. And once again, I'm thanking the team MES and Sajan sir for inviting me to this presentation. Hello.
Yes, sir.
Sir, is it viewable? My presentation is viewable?
Yeah, viewable.
Okay. So I'm starting from the basics. So the learning outcome of this webinar will be that you can understand the basics of COVID-19. That is the basic thing. Because without understanding the disease, we cannot do preventive or any role. So the most important thing is understanding the basics of the disease COVID-19. Coronavirus disease is the COVID-19 full form. 19 is 2019. And second point you will get from this webinar is prevention and guidelines for safe practices in the community. That is very important because in every medical scenario, first your safety is most important. Then only you can save others. And third part is the role of NSS during COVID-19. These are the three learning outcomes you will get from this webinar. Straight away, I'm going into my presentation. So everyone knows COVID-19, the word itself telling coronavirus, viral disease. That is the full form of the COVID. 19 is representing 2019. So basically, it is an infectious disease. I am not going into the medical details much. So just giving a brief of infectious disease. Infectious disease or contagious disease is a disease which spreads very fast or spread through any mode of contact. COVID-19 is a droplet infection, but there are other modes of transmission and there are other suspicions also because nowadays there is a talk of airborne transmission. Airborne transmission means transmitting through air, but till date it is not fully proven. There are a lot of suspicion. It might be transmitting as an airborne in enclosed spaces and all. So the virus which is causing COVID-19 is SARS coronavirus 2. SARS is severe acute respiratory syndrome. That is a respiratory infection, which is very severe in nature. And the most important thing in the picture itself, you can see. Next is it is a pandemic. So what is a pandemic? Pandemic means it is spread in more than one continent, or it is now In the case of COVID-19, it is not spread in more than one continent. It is seen almost in every continent except in Antarctica, where human presence is very less. So, if the disease spreads in more than one continent or more than 2 or 3 continents, we can call it as a pandemic. And WHO declared this COVID-19 as a pandemic in March 2020. It was found in November in Wuhan, China. Was the first traced contact. Actually, the contact was earlier, but it was first traced in 17th November 2019 in Wuhan. It is in Hubei province. It is a central province in the China. Actually, it was traced in a wet market. Wet market means where direct selling of meat or live cutting of the meat occurs. So it was first traced in Wuhan, in the Hubei province of the China. And most importantly, you can see in the picture that its primary host is bat. But one important thing is that in bat, it does not cause much diseases. Then there is an intermediate host in between bat and human. That is, difference of opinions are there. It's suspected as civet cats is the one of the intermediate host. What happened is that in that it is not that much contagious or not, it is not causing big damages to that. But in the next intermediate host, the strength of the virus get amplified and then it get transmitted into the humans. Then it caused much problem. But earlier, actually, you can see that it is SARS-CoV-2. So there is CoV-1 is also there. Coronavirus 1 is in the 2003 pandemic, so, but it is not much severe in India. It is much severe in this China, Hong Kong, and like countries. So that is why we have termed this as coronavirus 2, because coronavirus 1 is happened in 2003. Actually, in coronavirus family, you can see there are more than 7 type of viruses are more than not 7, more than 7, because it is a quickly genetic mutating virus. Because it's mutation, even there is a opinion in Gujarat, the viral strain we have decoded is different from the Middle East. So there is a quick mutation chances are there. And in the case of India, the first index case means the first case or the first reported case in our country is from Thrissur district. It was a student who came from Wuhan University. He was studying in Wuhan University and he is the first index patient or the patient zero reported in Kerala in January. And most importantly, the word zoonotic. Zoonotic means the diseases transmitted from the animals to humans. There are a lot of zoonotics and there are a lot of pandemics in zoonotics. Hope you all know plague. Bubonic plague. That is, bubonic plague has caused severe death in human history. That is also a zoonotic. Anthrax is a zoonotic and lot of disease. Whenever human come in contact with animals, that is domestication of animals, eating meat of animals, what happened then the zoonotic or the transmission of diseases from human to animal happens. So such type of disease is called zoonotics. Hope you have understood the first slide. I can now moving into the second part of the slide. So from this picture, you can see that COVID-19 in the scenario in the world. There is actually this was a picture last updated in 1st May. But now the condition is more severe. You can see from the color, there is USA is very dark in color. India is affected. Only some places in Africa is not much affected, but most of the places are affected. That is why we call it as a pandemic. Now more than 14 crore people are affected by COVID-19 and more than 6 lakh deaths happen all over the world. I just showed this picture to understand the scenario in the world. One thing is very important in disaster management preview and in the COVID-19 preview. Usually, if it is a small epidemic or a small endemic disease, endemic means in a small area, you can get support of the other people. But in COVID-19, what is happening? You are not able to get the support of the people from other countries or other people because everyone is affected. That is a very, very important in disaster preview. Because if it is a flood, you can get help from the other states, you can get help from the other countries, you can get help from the other parts of the world where our citizens are living. You can hope you are remembering our flood memories. We have got a lot of support from our NRIs. But in COVID-19 preview, we can't get any help because everyone is affected. That is the importance of the word pandemic. Actually, I forgot to tell all those details while telling the pandemic. So in a pandemic, everyone is affected. And even because otherwise you will get help from the other part. So that is very important. That is why I put this slide, because you cannot get help from others because others are also equally affected financially and health status, everything. So now we will move on to the scenario of the India. COVID-19 in India. Actually, this was last updated in 7th July. So the situation you can see in Kerala. Actually, now Kerala situation is more worse than this. Actually, in this picture, Tamil Nadu and Maharashtra, Gujarat are more affected than Kerala. But actually, now Kerala is becoming a hotbed or hotspot or hotspot because lot of clusters are forming. So a lot of cases are reporting after this July 7 also. Tamil Nadu is severely affected. Maharashtra is severely affected. Delhi is severely affected because from this trend itself, you can know that the first what happened. First, COVID-19 affected in high-profile cities because people are very crowded. For example, New York, Milan, Italy, like those places. Then it started affecting the other second-tier cities. For example, Mumbai, Chennai, all places it affected is crowded places. So we have to understand the demographics of the place in the preview of the NSS also. NSS also you have to understand the demographic pattern of your place. Then you can understand in which place it will be affected. For example, if it is a crowded place, for example, MES Erumeli, Kottayam district, you can understand what are the chances of affecting of each place. So if it is a crowded place, chance of affecting COVID-19 is more. But if it is a less crowded place, chance of affecting COVID-19 is comparatively less. Even if it is affected, we can control. So always we have to, the NSS person or a National Service Program Officer or volunteer should have a proactive mind in dealing with these things. Don't wait for the COVID-19 to get affected in a vast scale. Before coming or before you can act proactively. You can understand the demographic pattern. You can understand the geriatric population. 1 second. That is very important because we have to know our place thoroughly. In whatever place, in wherever you are working, you have to understand the demographic pattern of that place. Why I said this? Because when you look at the pattern of COVID-19 disease, you can very easily understand that the geriatric population is severely affected. So you have to know how much geriatric population in your place. So, for example, in Kerala's general population, I will tell in Kerala's general population, approximately 12 to 13% are geriatric persons or above 60%. So 12 to 13% is geriatric. That is approximately 48 to 50 lakh people in Kerala are above 60. Those are the persons that are going to affect very seriously. So you have to understand that is why our state government, our honorable chief minister brought in the concept of reverse quarantine or importance of reverse quarantine is a concept in the world, but our state has given more importance to reverse quarantine because we have a more geriatric population than any other state in India, or Kerala has a more geriatric population than any other state. Second state is Tamil Nadu having 11.1% of geriatric population. Kerala has another problem also, lot of urban diseases are more in. So even if you are not a geriatric person, if you are affected with lifestyle disease like diabetes, it is called NCDs, non-communicable disease like diabetes, hypertension, cholesterol. Hope you know all these words. If you are affected by any one of these, there are a high chance of going into risk. If you are a healthy person, no need to worry, but you have to get all the statistics in your hand before acting. That is very important. You have to know how much geriatric population in your place, how much persons are affected. Actually, our state is now struggling to get all these data correctly. Actually, it is supposed to have every PHC or primary health center and Ayurveda centers should have these data, but unfortunately, it is not updated. So it is our role to get updated all these details. These are all statistics. So you can know who are the persons who are getting chances of more or COVID-19 19. So next we'll go into the scenario of the Kerala. In the Kerala, you can see that this is actually day 15th, 15th July. You can now see that Trivandrum is 909, 19 in 15th July. Now it is 20. It is now above 2000. So that is very, very important. You don't have sufficient time after getting the disease affected. That is the very important. From 919 to, I think, yesterday's statistics is 2100 persons on treatment, not total positive, on treatment. We are now struggling to get our this COVID first line treatment centers active, because even stadiums are converted in Trivandrum. This Calicut Greenfield Stadium is converted into a COVID-19 center, because cases are getting very fast. So actually the time of action is very less, because so I am telling that in Kottayam area actually cases are less according to this. Not in Kottayam area or in any area, because a lot of participants are hearing this. Everyone in the area should get the basic statistics ready. Then only actually it is the duty of the program officer to collect all those things. Then how to act, those things we have to keep in mind while dealing. Actually, the most important thing in Kerala is that our geriatric population is very high. Our actually in Kerala it is called as the diabetic capital of India. So diabetes are like these non-communicable diseases are very high. So it is very important. We should be more proactive in our taking steps. Now also we can do a lot of things that we will discuss on the later part of the seminar. Next, we will go on to the science. I am not going to much medical details, just giving the minimum medical details. There is, I tried to bring in more pictures. So just going through the pictures, you can understand. Basically, you should know. The first or the most important thing is the fever. Fever is the first and the most preliminary symptom usually seen in the patients. That is why we are using this infrared thermal scanners for understanding the temperature without touching. Next most important is cough. Cough, actually dry cough is more common. Dry cough without sputum cough. And then third thing is the sore throat. Sore throat is also very common in COVID-19 patients. Then next is fatigue. Severe fatigue is there. Shortness of breath. Usually this is coming on the later stages. Sudden loss of smell and taste. Headache will be there. Muscle aches will be there, and diarrhea will be there. So depending, and most important thing is symptoms start about 1 day after exposure, but usually on the 5th or the 6th day. So usually some people will get panicked if someone went to shop and there is a COVID exposure, then they will suddenly want to get tested. Actually, sudden testing is of no use, because most probably it will not, the virus, even RT-PCR test will not get you the correct result. So actually 5th or 6th day is the ideal day. Not actually it is not told it specifically. Mostly the symptoms are coming on the 5th and 6th day, and it can come up to 14 days. But there are also certain cases up to 28 days. Actually in Kerala we are doing as a 14-day strict quarantine period and 14-day observation period. So total it comes in the 28 days. In the observation period, you can move for very important activities like going for work or going to buy the essentials. You can't go for other things. And if any symptoms of any above 9 symptoms occurs, you have to report to the nearest healthcare. And the most important thing in Trivandrum, it is very commonly seen that asymptomatic patients are also very common. Next is modes of transmission. This is very, very important, or how this COVID-19 get transmitted. The firstly, on the first stage, it was these travelers spread the virus to many countries. On the next stage, it comes the mixed traveler means human transmission. Human transmission is, we can classify it as three. One is symptomatic transmission. Symptomatic transmission means the patient who have developed symptoms like fever, cough, etc., transmitting the disease. Pre-symptomatic transmission is a very important thing, but difficult to identify, because those who are getting COVID-19 on the first 1 or 2 days, sometimes they won't get any symptoms. they can also transmit virus. And then this is the asymptomatic transmission. Asymptomatic transmission, there are some doubts, but mostly now it is confirmed. A lot of cases are reporting through asymptomatic transmission. Actually, WHO confirmed statement is droplet transmission. Droplet transmission is that when you are coughing, when you are sneezing, when you are talking, these droplets will carry viruses, and that will lead to diseases in other person. So that is why we are using masks. Even cloth mask can prevent a lot of things, and the importance of face shield is also very important. Actually, when this NSS volunteers or persons or these volunteers are going, face shield is a very effective thing, more than mask, because it is very effective while in flight travels also. If you are dealing with closely packed people, face shield helps you a lot, because when we are working, personally also when I am working in the domestic airport, they used to give us PPE kit and all, but face shield also very important, because a lot of droplets will affected only on the face shield. Next is touching contaminated objects or contact transmission. Contact transmission is always difficult to means difficult to prevent, because we don't know lot of by if a person having COVID-19 touches on some surfaces, the virus will remain in the surface. There are a lot of controversies also, because how many days virus will live on different surfaces. That is all on the research preview. But different opinions are also there. But better don't touch every social places. Particularly avoid touching. Glouses can help, but no need of glouses. You can use sanitizer. That is the best thing I prefer, because everyone cannot use gloves, and it is not practical also. And then next is medical procedures that you don't need to get worried. And then sputum and saliva is always the main mode of transmission. Usually it is not a sexually transmitted infection. Next is just to understand the basics of the testing, detecting virus tests. Detecting virus. Actually, there are basically, you have to understand, lot of names are told in the COVID-19 preview. Lot of test names are told. Only basically you have to understand two things. One group of tests is a test conducting virus or test to identify the virus, and the second group of test is serology test. So we can understand this RT-PCR. Actually, this is the right test for the COVID-19, but it is not practical in all scenarios. Actually, RT-PCR means reverse transcription polymerase chain reaction test. In this test, what we are doing is that we will amplify the RNA of the virus. First, we will change the RNA into DNA, and then we will amplify. So even a single or two or three viruses are there, we can get, but it is very it is costly, but and time take, but accurate. So usually the first line of test is antigen test. Usually antigen test is the most common test nowadays used, and you can get results up to within 30 minutes or 30 minutes to 1 hour. You can get results. Even in the airport, we are using this antigen test. It is very fast, almost accurate, but sometimes we have to confirm with RT-PCR. Both RT-PCR test and antigen test, we are taking this fluid from the inside of the nasal cavity, not fluid, just viral particles. Then next type of test is serology test, that is called antibody test. For this, we are using this blood of the patient. But usually this we can in this also we can get fast results. But usually this is to understand the community spread of the diseases. There are lot of type of tests. For example, pooled test. Pooled test, just you have to. I am telling all these to understand these words, because sometimes we have to, as an NSS volunteer, sometimes we have to tell the contact patient, because nowadays lot of people are getting confused. Even in Pundra, one scenario has happened. People started talking against this antigen test by saying this antigen test is not correct. Actually, it is not. Antigen tests are correct and very fast. But why this happened? Because of ignorance. Because people don't know what is happening, and there are lot of fake means news are also spreading against this. So you have to, whenever a volunteer of NSS, a volunteer of or any volunteer, not only NSS, or any volunteer who is acting on the COVID-19, even you are not a volunteer, even you are a citizen also, you have to know these things. You have to understand that there are basically two type of tests. One is understanding or detecting the virus, and the other is serology test. Usually this detecting virus test, antigen test is the most common test. You will get the result in 30 minutes. It's almost accurate, and you can get the results very fast also. And next is serology test. Serology test, antibody test, you can get two type of antibodies are there. One antibody is if it is for example this IgG antibody present, you have got immunity, you can donate plasma. And there are another type of antibody called IgM. If and IgM antibody is present, it means you are you are now infected, like that. Now I am not going to detail of those things, and just you understand this thing. And one is pooled test, because this is usually done in a community. Usually when we are on the for example a group of health workers working in a common place, we can get for a pooled test. For a pooled test, all the samples get pooled, and then we will go for a testing. And if anyone is positive, then we will go for individual testing. If no one is positive, you can save the test kit and etc. So this is the diagnostic review. You just understand what is RT-PCR, what is antigen test, what is antibody test. Antigen test is the most important thing. It is very commonly done, very fast results. RT-PCR is more accurate, but usually done for confirmatory. So I think the diagnosis part, signs and symptom parts are clear for you. Next is management. Usually management now is limited to very less things. Basically supportive care. Supportive care means giving support to the patient, whatever support he needs. Because for example, if the dehydration or any tiredness, you can give fluids, that is IV drips and all. If patient is having distress, respiratory distress, we can give oxygen support. And if severe distress, we can go for ventilator support. And antiviral drugs are also given in severe cases according to the need. I'm not going into details of the management. You just understand what is happening in this. Actually, government is now classified hospitals into basically into two. One is COVID first line treatment center having the basic supportive care, and then COVID hospitals having ventilator support and all. Why I am telling this? Because you have to understand what is going in a COVID first line treatment center. In COVID first line treatment center, what is happening is that this actually the patients get mostly asymptomatic patients are getting admitted there, and patients having very less symptoms are also getting admitted. Any patient are having more symptoms will usually get transported to COVID hospitals. Actually, we have a quarantine care centers, that is the first line. Then second line is COVID first line treatment centers. Third line is COVID hospitals having all the facilities. Next, this is the prognosis. Usually, why I am telling this is because you can convey these things to common people. So there is no need to panic. Almost 80%, if 100 people get affected by COVID-19, 80% of the patients will get cured without any problem, because there are a lot of stigma and fear attached to the COVID-19, because people are fearing like anything. That is very, very important. So we have to tell the people, or we have to tell the volunteers, or we have to tell, no need to panic. Only 20% get severe. 80% or 80 to 81% will get only very mild disease. That is a very important thing. 14% get severe. 14% are severe in nature, uh, but you can treat them, no problem. 5% go to critical care, that is need ventilator support and all. In this, only 2.3% of cases are chances of death are there. But if what happens is that in a huge population, this 2.3% is also a big number. That is the problem we are discussing always. So the first part is over. Hope you are clear with the first part. Only 2 or 3 points you have to remember. One point is that it is a pandemic. Second point, you have to remember the basic symptoms, that even everyone is familiar with the symptoms, but you have to understand, any person having fever, sore throat, cough, tell him to remain in home or isolate himself. Don't tell him he has COVID, but only tell him just remain in your home and get isolated. That is the most important. Even a volunteer, I am a health worker, I am a doctor. If I am getting affected by any of the fever or cough or anything, I am not going directly for testing. I am just self-isolate in your room. And don't always tell your kids and grandparents not to come in the room, and tell one of the members in your family to help you. So the most important message you have to tell that if you have a symptom, isolate in your room. That is very, very important. Then that is about the symptoms and the basics of the test. Also, I have told two type of tests. One is identifying the virus, that is identifying the virus. Two tests. One is RT-PCR test, and the second one is antigen test, and then this antibody testing also. So these are the basic testing and different type of tests, pool tests and all those things. And prognosis means how chances of curing, that is also very high, that is 80%. And India has a very distinct advantage, that is cure rate. Cure rate means those who are getting cured from the disease is very high, or the cure rate in India is very high compared to Italy or compared to any other European countries. Our strategy is very effective. That is why the cure means patients getting cured is very high in number. That is a big success story. In Kerala, the number of deaths also very less. Now I think it is 42, 43, but it is very less compared to other states in our country. So these are our strengths. And then that is the prognosis. And next we will go into the preventive part. Preventive part is very, very important because one second. Preventive part is also very important. Actually, the preventive part I have included in 4 headings. Why? Because it is easy to remember. One is the hand hygiene. Hand hygiene is very important, or correct hand washing technique is very important, that I will tell in the next slide. Respiratory hygiene. Respiratory hygiene is very important. Social distancing and high risk group. You have to understand the high risk group also. There is one word you can remember, SMS, that is social distance, M for mask, and S for sanitizing, that you can also remember. This is the effective hand washing technique. Only thing you have to remember in hand washing is that you have to wash for at least 20 seconds. There with proper best is hand washers. You have to wash all parts of the hand. Actually, this is the right way you have to do this. But most important thing is that either you can count 1, 2, 3 like that. So wash on the every aspect of the hand and rub. Maximum friction is the most important thing while washing the hand. That is the word. I once again repeat the word friction. Friction of both, or rubbing your hand, is the most important part in hand washing technique. So it is very important, or very actually, by washing with soap and water or hand wash, you are preventing this COVID-19. It is more effective than sanitizer. Why? Because the this envelope of the virus will get broken by the soap water. So hand washing is a very effective technique. So that is, you have to remember, and try to count 1 to 20 seconds, or count in mind. So you have to get sufficient time for washing. Next is respiratory hygiene. Respiratory hygiene is always very important. Use handkerchief. Handkerchief is the best method, or otherwise there is another technique, using the elbow, or the one side of the elbow also, if there is no handkerchief. And never use throw not only tissue but masks. Only throw in a closed bin. Always try to cover your sneeze. Wash hands immediately if it is possible, or hand sanitize. Don't spit in open place. I think now it is a punishable offense according to our this new latest act Kerala government has invoked. So always the respiratory hygiene is very important. Next is the high risk group. Actually, kids I have not included, so I have put in the headline itself. So older adults not above 70 or above 80, above 60, there is a high chance. So whoever in your home, always above 60 and below 10, never go outside. That is very important. You have to tell the persons who are in the home always try to avoid the older adults and the kids to go out from the home. That is very, very important. And next is those who are having the underlying medical conditions. That is also very important. Underlying medical condition, their age is not important. If you have a condition in your age 35, that is also a problem. If you are diabetic, not only actually it is not diabetic, but the most important thing is if it is not properly controlled, that is the most important point. If you have diabetes and you are not taking proper medicines, or if you are hypertensive, you are not taking proper medicines, or if you are any disease, it is not properly controlled, there is a high chance of aggravating the disease when you get the COVID virus. So always keep your health condition pakka, or fitness is very important. You have to, that is why actually we are promoting a lot of yoga, like respiratory enhancement measures. Yoga is very effective. You can, anyone can do. Actually now yoga day is also there. Only not you, even asanas are not important. Even this basic pranayama techniques or breathing techniques or deep breathing techniques are very important. So always you can advise that things to person, those who have no diseases. Pregnant women is also a very high risk category, and kids, those who are below 10. But actually in the case of kids, you have got an extra advantage. Actually kids, death of kids are reported less, or severity of cases in kids are less, because they have got certain immune measures compared to adults. Next is social distancing. Social distancing, actually 1 meter is the 1 meter. Never go for 1 meter. Actually, CDC, American CDC is telling 2 meters. Just you have to remember only one thing: one upper limb distance, like this, full upper limb. That is from your fingers to shoulder. That is the length. Minimum distance you have to keep from the other person. Actually, if it is double, it is better. So social distancing is very important whenever you go into shops, or whenever you go for telling that you, whenever you're sometimes as a volunteer, as an NSS volunteer, when you are trying to give awareness to the public, always try to keep this minimum 1 meter distance. So so you have to talk loudly whenever actually it is on the initial phases. Usually it will feel difficult because we have to talk loudly, because we are keeping 1 meter distance, then we are using mask, then we are using face shield. Look, three things are there. So you have to talk loudly. Then only it will be audible to other persons. And it is told as minimum 1 meter. Actually 2 meter is the ideal thing, but sometimes when you are going on the shops, 2 meter is difficult. So at least 1 meter you have to. And most important, try to remain home, only for essential things you go out. And don't say avoid gatherings or avoid events. Even in our colleges and in our hospitals, the meetings are nowadays, even the available persons will try to use the Zoom or any online platforms, because meetings are always can always convey risks. Because in our hospitals, etc., we are usually working as team A, team B, because if one team get quarantined, the other team will take over. And avoid crowded places, and avoid public transport, because there is a high chance no one knows how many people are using this. Then I'm going into the role of NSS. There is a role of NSS is very important, because NSS or National Service Scheme has very important things National Service Scheme can do. One thing is helping the health team in community surveillance, or identifying and contact tracing. That is very important, because nowadays the health team is suffering due to shortage of people, because a lot of energy is going in for this contact tracing. Actually these things, these young volunteers can assist the health professionals, because they can help in community surveillance. There is a big activity, because for example, if one patient get affected, you have to trace the whole persons who is in contact and identify where is he, and then only you can understand what is his status. Actually there is a big team of health, and big energy of the health team is going for this community surveillance, because it is very important. Actually the WHO has concised the whole thing into 3 T's, that is testing, tracing, and treatment. So this testing, before testing, you need tracing. So this tracing part is otherwise called as surveillance activity. In this surveillance activity, these volunteers can do a lot of things because they can support the health team. So what advantage is that, the most important advantage is that the health team's energy will not be spent most on this, because nowadays what happening in Kerala is when the cases are rising, the doctors and other health teams have to concentrate on the treatment part or on the treatment side. So the surveillance getting less. So these parts we can, our NSS volunteers can cover and help in contact tracing and supporting the suspected symptomatic and asymptomatic. You can convey the basic awareness things to symptomatic persons and asymptomatic persons. Supporting the quarantine people. That is very important, because if a person or a family usually nowadays it is not room quarantine, now it is home quarantine, because the whole family get quarantined. What happens? You can't go out to buy things, or you can't go out for anything. So there is a lot of energy, a lot of people are needed for supporting this quarantine people. That is very, very important. Then supporting the reverse quarantine people. That is also very important. You want to go to banks, or you want, a lot of people are not knowing the digital things. So there is a big gap. So that gap can be sufficiently reduced by the action of NSS. So there is a very, very big area. Actually, I am not going to each and every things, because I am just giving the brief areas where NSS can act. So the next stage is plan, making action plans and all for this. So the supporting areas, one is quarantine people and the other is reverse quarantine people. And then creating awareness in the community. That is very, very important. Creating awareness is very, very important, because nowadays also lot of people, there are two type of people you can see in the public. One type of people are fearing like anything. They think they will not go out, or they will tell their relatives to don't go out. But it is not like that. You can go out, but taking sufficient precautions. And there is another type of people thinks that they will never get COVID-19. So they will not obey anything, and they will think that only the some people will get, I will not get. So there are these two type of activities, or these two type of people are wrong. So always a mediocre stand is important. And removing stigma, that we will come into the next slide. So I will once again tell you the main areas of the role of it. One, information to the community. That is very, very important, because nowadays the most important part of the majority of the community have no proper information about the disease. So that you can convey. No need to panic, only understand the disease. Then by understanding the disease itself, the fear will reduce. Then third, you can take part a big role in the community surveillance in identifying contacts and all. And fourth part is stigma and discrimination. That is a very important part that we will deal in later. And then next is personal safety. Not only our personal safety, or our community's personal safety also. There are simple things. Whenever you go outside, always when you come back, you always keep remove your dress and wash in the in surf water with soap water, because by just dipping your clothes 30 minutes in soap water, you can remove the virus or the threat of virus. These are very simple measures. And don't carry bags and all those things to inside your home. Better to keep outside, or a place where you can keep bag, your chappals and all those things. And whenever your kids or grandparents or any person from home is coming, tell him, don't touch me. After bathing, you can touch me. That are the basic. These are the basic things the volunteers or those who are giving awareness should keep. Because these are basic things, but it is very important. Otherwise, what happens? You will get also affected, and you will transmit the disease. So these basic things are very important. And then next is supportive public health service. And this actually public health service is now very stretched, or not. How I can tell, I cannot get. I'm not getting the exact term. It is very much stretched, because the health team is working for past actually from the domestic surveillance, domestic airport surveillance started in the March 18, I think March 18, 2020. So now it is July. It is now the health team is almost is exhausted, and the almost health service get overstretched. So what happened? You whatever things other people can do. Actually, the lot of people in our community are very knowledge persons, and they all can support by bringing extra support or extra energy to the health team. what we get is that the right amount of energy or intervention needed in the treatment of patients, we can give that, and the other energy or the other part can be taken by this national service scheme and volunteers. So the NSS has a big role in to play in this COVID-19, but after understanding the basics of the disease, otherwise you will be a carrier of the disease. So always understand the basics of the disease. So these are the roles we can play. Next is just understanding what is stigma, and why is there stigma, and what we can do. So what is stigma? In any epidemic, individual feels stressed and worried because they fear. I think a lot of people who are hearing this webinar is also having fear about COVID-19. Why? Because one, usually we think that okay, falling ill and dying. Oh, I will whether I will die or not. So you can tell what you can tell the person, or you can give awareness. Actually, this COVID-19 is a mild disease. Only for certain people or a high risk group, it is get into the next stage. Otherwise, 80% get cured. That is why or where your knowledge comes for your help. Fear of being infected while in care, or while you are caring your a person with COVID-19, if you are taking sufficient precaution, you will not get affected. Because I am saying this because I have worked very in close proximity with this COVID-19 patients in airport and CFL disease, but chances of disease is less. Getting disease is less if you obey all proper precautions. The most important thing is obey all proper precautions. And losing livelihoods, because lot of that is a big thing. If you have a shop, or if you are a daily breadwinner or earning for daily basis, livelihood is a big problem. Being socially excluded, that is a very important thing. Even very educated persons also try to exclude people. Even the health team or doctors are getting excluded in some places. Actually, we feel sad because people are getting means they are means over fearing by talking with this person whether I get. So only thing is that you have to tell them never to get panic. Just understand the basics of the disease, and uh, at least remember the term SMS, that is sanitization, mask, and social distancing. And powerless in protected loved ones, because you cannot protect your kids if you are in quarantine or if you are in a hospital. Helplessness, boredom, loneliness, and depression. Actually, depression is a big issue, or loneliness is a big issue. That a lot of people in quarantine are trying for suicide. Even in our medical college, this now COVID ward is having a psychiatric support for this, or this our helpline support is also there, and treated as an outcast or blamed for spreading the disease. These are the things. This is why stigma is always associated with this disease. And why is there a stigma? Because COVID-19 is a new disease, and lot of regulations or lot of knowledge is also keep changing. Because in a new disease, because earlier in our, hope you are remembering, in March and April, it is said that no need to use mask. But in May and June, the scenario changed. You have to use mask. So a lot of new things, and many new things are getting discovered, and unknown fears, and a lot of rumors or fake news. That is very important, because a lot of fake news are in there. So always tell the people to believe things in official websites, or you can, for example, GOK is an app by Kerala government. Always believe those things. Don't fall into rumors. That is why there is a stigma. So what does stigma do? Usually stigma make people hide their problems. Usually if you have a fever, you don't tell to health authorities. You will remain in your home, you will go out for your work, and you will try to infect others. Keep people away from accessing health service and seeing, that I already told. Discourages them and may at times adopting from unhealthy behavior also, they will sometimes adopt. And what can NSS do in stigma cases? Sensitize people. That is the most important thing. This actually, this part I have taken directly from the Ministry of Health of Central Government. That is sensitize people. It is a simple infection. 80% are mild cases. Only 20% are going into the severe condition. In that 20, 15% are severe, but we can that are treatable, and only less than 2 to 3% patients have fatality. So that thing you have to convey, and can happen to anyone. That is very important, because never think you are immune to COVID-19. If you are a doctor, if you are a prime minister, or if you are anything, You are not immune to COVID-19. COVID-19 is can happen to anyone. So that point is very important. So if someone is excluding someone, tell him there is a big chance of you are also getting COVID-19. So that thing you have to convey. Advice to engage in relaxing activities. Relaxation, whatever thing you can relax in your home, you can do that. Advice to stay away from negative and fake news that I already told. Engage community influencers, share correct information on COVID-19. That is very important, that engaging community influencers. That is when you are, sometimes if a doctor talks to a public, sometimes the public will not respond to that. But sometimes, for example, in Pundura, this father of the church helped the health workers a lot because his words are divine to people and people will obey. So identify the community influencers, tell them the matter, they will help you. So these are the things. So you can proactively do convey these things to them and they can help you. That is very important. And share correct information to them and tell them to convey the people. So it is very important. And emphasize most people do recover from COVID-19 that we have already talked. Make special effort to reach out to high risk groups. These high risk groups, you have to even through phone you can communicate these things. First do it in your own home, then try to communicate to others. So identify the high risk group and tell them. For kids, they don't know anything, just tell them don't go for playing to different places, only play within the home, that is safe. And for older people, tell them these are the things, so you have to take care of this. Don't worry about your health, we will take care of the health. The most important is confidence building measures, that is the most important thing. And then surveillance also, actually now or more than, I think it is 1 hour. Then also I will go fast into slides. So understand this surveillance activity, you can help in these health workers. So for that you have to understand the types of contact that I will tell in the next slide. In surveillance, these are the things: identifying the contact, community surveillance standard operating procedures, and advisories, what you have to do, and then you have to communicate. So type of contact. So there are two type of contact: high risk contact or primary contact, and secondary contact or low risk contact. High risk or primary contact. Primary contact is a person who is in direct contact with the patient. For example, if I am in direct contact with, one second. High risk contact or primary contact is a person having direct contact with a COVID-19 patient. For example, if I contacted a COVID-19 patient directly, I am a primary contact, and my son is a secondary contact because he is on the he contacted with me, not directly with the patient. So there are two type of contacts. Actually, not two, three type of contacts. It is not told in this slide. So you have to understand three type of contacts. One contact is the primary contact. Primary contact means those who is in direct contact with the patient. Then next is secondary contact. Secondary contact means those who is in contact with the primary contact. Actually, he doesn't need testing if symptoms doesn't occur. If symptoms occurs, then only the secondary contact get tested. But primary contact, always tell the primary contact to live in home for 14 or quarantine for minimum 14 days and observation for another 14 days. In observation period, you can go out for essential activities like work or buying essentials, but not to travel in other places. So there is primary contact, secondary contact, and third type is local contact. For example, if you what type of example I can tell? Okay, for example, if you have gone to a shop and some other persons have with COVID history has visited the shop, then you become only a local contact. Local contact has less chances of getting infected. So understand the primary, secondary, and local contact. These are the three type of contacts. So high risk group or primary contact touched body fluids, had direct physical contact, touched or cleaned things of the patient, lived in the same household in close proximity with the patient, or passenger traveling in close proximity, for example, airlines, flight. And low risk is shared same place or traveling in the same environment, travel in the same environment in a distant place. This is what is community surveillance, visiting local residents of the contact. Only the volunteers can assist the health workers. Never try to go alone because health worker is needed. Introduce yourself, explain the purpose of the surveillance, data collection, contacts of the confirmed cases get traced, collect information about the contact, and then advisory for the contacts. If it is asymptomatic, home quarantine 28 days after last exposure. Actually, nowadays 14 days is also told. Self-health monitoring and active monitoring. Direct and high-risk contact of a confirmed cases tested once between 5 and 14. Actually, one test, if you are a primary contact, one test is usually mandatory. Now antigen test. I have earlier told about antigen test. If you can get result within 30 minutes. Symptomatic, use mask, self-isolate and tell the health authorities and they will take you to the first-line COVID centers. Just I will end with this slide, Ayurveda and COVID-19, because I am from an Ayurvedic community. So Ayurveda now I do lot of things in during COVID-19. One is quarantine care, Project Amrita. Actually now almost every district in Kerala are using this Project Amradam. It consists of certain medicines, and we can proudly tell that in certain patients, the actually positive rate or COVID positive in quarantine care centers we can reduce by this through this Project Amradam. But further studies are needed. Actually, in Project Amradam, we will give certain medicines to the quarantine care people. Then convalescent care. After you are cured from COVID-19, there are certain health issues that can be addressed by the Project Punarjani, and lifestyle modifications, surveillance activities we are doing, supporting in running COVID first line treatment centers and quarantine centers, providing preventive medicine to high risk groups, and creating awareness in the public. These are activities we are doing. And thank you for listening. Whatever doubts you have, please ask your doubts. Whatever knowledge I am having, I will try to answer with my knowledge. Any doubts I am having, that I will address you later through email or any other modes of communication. Thank you for patient hearing. Sir.
Thank you, sir. Thank you, sir, for your effective presentation. It's very relevant to the present situation and pressing to the audience. We got so many doubts regarding this COVID-19. Participants have asked so many doubts, and our CDC coordinator, Jidesh KS, will convey you the doubts, sir. Over to you, Jidesh.
Thank you, Shibama. Good evening, sir. I think you are too. Okay. It's a very effective session. I think there is no room for any doubts because you explained very well about COVID and the how to manage the COVID by the social NSS unit in a college. Then the role of Ayurveda. I think your time is too limit for explain the Ayurveda and COVID. Some questions is connected to.
Anything you can ask. Just,
okay. We have some questions related to how to increase our immunity through Ayurveda medicines. So, is any medicines for increase our immunity level?
Actually, nowadays, what is that we are not giving this preventive medicine to common public. Only for high risk group, there are medicines. High risk group means those who are one. I already told about high risk group. There is older people or those who are exposed because, for example, police persons, doctors. Only for high risk group you need to take for this preventive medicine. For general public, actually, only thing is needed that you whatever diseases you are having controlled with all whatever medicines you are taking. No need to take any medicines.
Okay. Thank you. Enough, sir. Then another question is related to, sir, one more doubts is connected to is it test. Now, I think in Thiruvananthapuram, there is some controversies against the test.
Yeah.
Sir, can you give some more explanations on test? So you already mentioned it, but some questions are from that part.
Oh, yes. Anyway, I will mention it. The only thing is that usually the most accurate test is RT-PCR, that is reverse transcription polymerase chain reaction test. It is an expensive test and you will get results very late. So in that test, what happens is that you are identifying the virus. There is a swab test. So that is the ideal test. But what happens, it will not get quick result. So usual test is antigen test. Antigen means a protein. You are identifying a protein in your body. So that is very easily, you will get result within 30 to 45 minutes. Antigen tests are very correct. Only thing that in certain cases, you have to get reconfirmed with the RT-PCR test. And antibody testing now, it is not done. Usually it is not done. So antigen tests are very safe. Actually now government are giving advertisements for antigen test. Actually it is safe. You can use it everywhere. You can get result within 30 to 45 minutes. If it is positive, then you will be taken to first line COVID centers. Then your RT-PCR sample again you will be taken. So no need to worry about much into these tests. Only thing is that antigen tests are safe, effective, and easily identifiable, and you will get results within 30 to 45 minutes. And you can do in every place. In airport also, we are doing the same thing. You will get results within 30 minutes. So there is no room for doubt. Anything I will clear.
Okay. Sir, then also some questions related to
Yeah.
youth. Some points explained here. India is more youth and how it affect the youth. So we can conclude that question. I think our study, comparatively in our study, youth are not affected this COVID-19 in India. They are safe. Comparing to other category, we are in safe. But what are the precautions taken by the youth? You already discussed then also we have some in future, in near future, we are on safe. We believe we are on safe, but our youth in to the street. If you have any advice to the youth.
Actually, the one India, actually, when you're looking the statistics of India and Italy, what happens is that Indians youth population is much bigger than the Italy's youth population or United States youth population. Actually, we are more on the safe side because we have a big youth population. But one thing for Kerala, it is not like that. In Kerala, the geriatric population is more than 12%, or the highest in India. Just the second comes is the Tamil Nadu, and the first is Kerala having a big geriatric population. So my message to youth is that always try to create awareness among the public. First, start from your home. First, you get aware or you know the things very clearly. Now, lot of informations are available in the sites. Whenever you read sites or take information, always look for the genuine sites. Never get affected by the bogus sites or bogus WhatsApp things. Always try to reconfirm the news before forwarding. Because just before also I got a query from one of my friends that some is COVID can be passed through vegetables like that, or a lot of things, fake things are always transmitting. So for the youth, one thing is very important. Whenever you forwarding a thing or whenever you are telling a thing, always reconfirm the news you are forwarding. That is one most important thing. Second thing is that SMS. That is the more, just remember the term SMS. That is, whenever you go outside, whatever the basic thing is social distancing, mask, sanitizer. Always keep one small hand sanitizer in your pocket. Never don't go for this sanitizer that is kept outside the shop or outside the ATM center. Always keep a small sanitizer in your pocket. Always use mask. Don't go for expensive mask like this N95 and all. This N95 is needed for the health professionals. If all people are trying to buy N95, the health professionals, even there is a shortage of N95 mask. When you are going for a close proximity with a COVID-19, then you can use N95. Or never go for use usually homemade cloth mask, washable type is enough for doing. You wash it well. 30 minutes you have to soak and dip dry. That is the method of washing. And whenever you go outside the home, when you come back, you always dip your clothes 30 minutes in surf water or soap water. These are the basic things, very basic things of the personal hygiene. I think these are the things you are learning in our high school. Personal hygiene, usually one chapter is there. So these are the basic things. Only these things we have to keep in mind.
Okay, thank you, sir. Then also, you already mentioned our stigma. Our mental strength can overcome this problem also. So I think some advices to on that way. There are also some fake news has happened in recent years
Yeah.
related to COVID. Then some of the news is related to plasma therapy is most dangerous, something related to. So is any true truth or
No, no, no.
something is
Plasma therapy is actually it is not given for everything. Only for severe patients or critically ill patient, there is two chances. Only either he will go to death, or otherwise we can try this therapy. So there is no need. Not every patient is getting the plasma therapy. Only a very severely or critically ill patient will get a plasma therapy. And now the first plasma bank has started in Malappuram. Hope you have read in the paper. So there is no need to get panic into those things. Only actually those who are getting actually antibody test IG G is positive, you can donate your plasma. Actually, a lot of people are now willing for donating plasma because now our COVID cure rate is very high. So lot of people can donate plasma and lot of people can save other people's lives.
Then is
Okay, sir.
another question is very familiar, but here I think it's relevant for sir. What are the chance of transfer of virus through currency? I think it's a
Through
general question
currency.
through.
Yeah. Actually, if you say there is a high chance, it is there. But only thing is that you can go cashless, but it is not possible in every scenario. But one thing you can do, you can sanitize your hand after touching the currency. That you can do.
Right, right, right.
So everywhere digital is not possible. So only one thing, after touching currency, you can take the hand sanitizer from your pocket and hand sanitize.
Okay. Sir, we have more questions, but our time is beyond our time. Then now it's for 4:15. Then
Yeah.
it's a time to wind up our session. We have
Okay.
so many
Okay.
doubts, so we will collect it and send to your mail ID.
Always, always,
Then
always,
if
sir.
you can
Thank you. Thank you.
send back to the.
Always, always. Thank you,
Okay,
sir.
Shiba
Thank you,
ma'am.
ma'am.
No.
Okay, thank you, Doctor, once again for your informative presentation. You have cleared and explained almost all doubts, sir. For a formal vote of thanks, I once again welcome our CDC Director, Sri Jidesh KS. Over to you, Jidesh.
Thank you, ma'am. Good evening, sir. Good evening, honorable resource person, our principal, vice principal, IKC, and all faculties and very honorable participants of this webinar. I consider it is a great privilege to propose a vote of thanks to all the dignitaries who have witnessed it as a memorable and successful event. So today, my words are not enough to express the gratitude. Our chief resource person, Dr. Prasanth Sir, Professor Government Ayurveda College, Thiruvananthapuram, his words provoking his efforts put to prevent this epidemic, how to prevent this epidemic. Hope this thought provoking address set a perfect platform for our community. On behalf of MES College Erimeli, I would like to thank our resource person, Dr. Prasanth Sir. Thank you, sir, for your valuable presentation.
Thank you, sir. Thank you.
I would like to
So
thank
what?
our beloved principal for all words of wisdom that radiated source of energy within us. We will ever remain grateful to you, sir. And we thank for being with us today. Thank you, Principal Mahin, sir. We express sincere gratitude towards the management of MES College Erimeli for the unextended support for giving webinars or programs organized under IQAC. Thanks to our management committee. Our college witnessed many times for the efforts of our NSS program officers in various programs, and it's a successful ending. The leadership vested by our valuable program officers. I use this time to express gratitude towards our program officers, Mrs. Rajula OM, Mr. Sajan Anthony. Thank you, Rajula Miss and Sajan sir. Now we have already organized more than 15 webinars in this short period. All the webinars are organized by under the guidance of IQAC. Our IQAC is led by our vice principal Rama Devi Madam, IQAC coordinator. Thanks for organizing such wonderful webinars in our college. Thank you, Rama ma'am. Then the persons behind the screens, our ITSL team. ITSL is led by Sabjan Yusuf, and the participants or the supporting team are Tanseem, Jinesh, Jace John, Anandu, for a valuable support for successing this webinar. Thank you, the whole team. Last but not least, I thank all the participants for your cooperation and made this event successful completion. We feel proud and thank you for making us feel happy with your presence for this function. Once again, thank you very much to all who joined here. Thank you.
Okay,
Yes,
sir.
sir.
Can I leave, sir?
Shall we wind up, sir?
Yes.
Okay, sir. Can I leave also?
Yes,
Yeah.
yes, yes.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir. Once again from the MES family, sir.
ഞാൻ ആദ്യമായി കോളേജിൽ പോകുമ്പോൾ ഭാവിയെക്കുറിച്ചുള്ള ആശങ്ക പലതായിരുന്നു. എന്നാൽ സുന്ദരമായ ആ ക്യാമ്പസിലേക്ക് കയറി ചെല്ലുമ്പോൾ ഒരു ആത്മവിശ്വാസം എനിക്ക് ലഭിച്ചു. നല്ല സുഹൃത്തുക്കൾ, സംശയമകറ്റി വെളിച്ചം പകർന്നു തന്ന അധ്യാപകർ, പുതിയ ആശയങ്ങൾ നൽകിയ ലൈബ്രറി, ഏകാഗ്രതയും നല്ല ഓർമ്മകളും നൽകിയ ക്ലാസ് റൂമുകൾ, ഡിജിറ്റൽ ലോകത്തേക്ക് പറക്കാൻ പഠിപ്പിച്ച കമ്പ്യൂട്ടർ ലാബ്. അങ്ങനെ MES കോളേജ് എന്നെ ഉയരങ്ങളിലേക്ക് സ്വപ്നം കാണുവാൻ പഠിപ്പിച്ചു. ഇന്ന് ഞാൻ വളരെ ഹാപ്പിയാണ്. സ്വപ്നങ്ങളെ പിന്നിലാക്കി ഉയരങ്ങളിലേക്ക് ഞാൻ പറന്നുകൊണ്ടിരിക്കുന്നു. You have to dream before your dreams can come true.
MES Collage, Erimeli, proposed PO, Erimeli, Kottayam, unaided Arts and Science College under the Muslim Educational Society, approved by Government of Kerala and affiliated to the Mahatma Gandhi University.
ഞാൻ ആദ്യമായി കോളേജിൽ പോകുമ്പോൾ ഭാവിയെക്കുറിച്ചുള്ള ആശങ്ക പലതായിരുന്നു. എന്നാൽ സുന്ദരമായ ആ ക്യാമ്പസിലേക്ക് കയറി ചെല്ലുമ്പോൾ ഒരു ആത്മവിശ്വാസം എനിക്ക് ലഭിച്ചു. നല്ല സുഹൃത്തുക്കൾ, സംശയമകറ്റി വെളിച്ചം പകർന്നു തന്ന അധ്യാപകർ, പുതിയ ആശയങ്ങൾ നൽകിയ ലൈബ്രറി, ഏകാഗ്രതയും നല്ല ഓർമ്മകളും നൽകിയ ക്ലാസ് റൂമുകൾ, ഡിജിറ്റൽ ലോകത്തേക്ക് പറക്കാൻ പഠിപ്പിച്ച കമ്പ്യൂട്ടർ ലാബ്. അങ്ങനെ MES കോളേജ് എന്നെ ഉയരങ്ങളിലേക്ക് സ്വപ്നം കാണുവാൻ പഠിപ്പിച്ചു. ഇന്ന് ഞാൻ വളരെ ഹാപ്പിയാണ്. സ്വപ്നങ്ങളെ പിന്നിലാക്കി ഉയരങ്ങളിലേക്ക് ഞാൻ പറന്നുകൊണ്ടിരിക്കുന്നു. You have to dream before your dreams can come true.
MES College, Erimeli, proposed PO, Erimeli, Kottayam, unaided Arts and Science College under the Muslim Educational Society, approved by Government of Kerala and affiliated to the Mahatma Gandhi University.